Hello, everybody. My name is Jill. I'm a McKendree University student and I'm in my last semester of my bachelor's program. I live in Washington County, Illinois. It's a small community consisting of just under 15,000 people that's located in southern Illinois. I also work in the county hospital in the ER. And just recently, it seems this community has seen an increase in the number of hospital visits related to drug abuse and overdoses resulting in deaths. Heroin and K2 seem to be some of the most common drugs being seen in the area that's greatly affecting the residents. That's why I work in the ER, and that's why I had chose to pick this topic because there's not a week that goes by that I do not treat somebody for something related to drug use or drug overdose. So the following PowerPoint is going to touch on some of the literature, and I had given a presentation at Oakville High School. It's going to touch on that as well. I hope you enjoy.
The Nashville newspaper is a small newspaper produced once a week. It's located in Washington County, and the paper from February 17th of 2016 had a front page article with the title, Sheriff Says Department is Shifting Priorities for Heroin Problem. Within this article, it was noted that Sheriff Danny Braddock stated heroin is here. Although he doesn't feel it's at epidemic proportions yet, he still wants to address the issue before it gets any worse. He said there was currently 16 county inmates that were incarcerated in the jail due to the drug issues in the county. Not all of these were heroin or K2 related, but many of them were related to the heroin. He also had mentioned Mark Steininger was addressing the issue as well. So I had an interview with Mark Steininger on March 16, 2016. He confirmed there were 3 deaths from heroin use in the last 6 months, with another 4 still being investigated. Heroin is the most rapid-acting opioid drug known. It is highly addictive, and it comes in many different forms, ranging from a white powdery substance to a black tarry substance that can be smoked, injected, or sniffed. Research actually has shown this has become an epidemic and is being seen throughout the United States. The findings by the David Johnson and Pierce shown there was a 600% increase in drug overdoses in the United States in just the last 3 decades. Heroin also is not a regulated substance, and therefore it often differs in strength. The dealers cut the product with other inactive ingredients to expand the volume, which in turn increases the drug dealer's income. But recently, the forms of heroin have been seen to be a lot purer, which has been resulting in a lot more overdoses. Overdosing on heroin is displayed by drowsiness, respiratory depression, constricted pupils, and it is the most common cause of death for heroin use. Although there is a reversal agent, Narcan, many users hesitate in utilizing this because it will negate their high. The effects of heroin has on a person is somewhat consistent for majority of its users. These effects include a rapid feeling of euphoria, followed by what the user There is an extensive amount of literature on heroin use, side effects, suggestive interventions, and treatment options. One intervention that I stumbled across was written by Dark and Farrell, which examined an argument to legalize heroin use. The author suggested by that legalizing heroin, or at least decriminalizing heroin, and controlling the substance purity and available additives, overall heroin overdoses would then be decreased. Evidence-based legalization of heroin-assisted programs have been proven to be successful in the United Kingdom, which resulted in a decrease of overdoses. Although this was thought to be too costly to attempt in other countries because of the amount of resources needed. After researching this topic further, this literature found that the legal status of heroin would prove to have no substantial impact in reducing heroin overdoses. Other literature notes the need to increase the amount of physicians qualified to treat heroin cases with methadone. A report by Hattie and Haverstick estimated that between 600,000 and 1.5 million Americans currently use heroin, and physicians qualified to treat these patients with methadone had increased from 1,800 in 2003 to around 16,000 in 2012. Although the treatment facilities were readily available, the author noted that there had been some barriers to provide appropriate treatment. Such barriers as the provider's willingness to prescribe, insurance companies' willingness to cover such claims, and overall costs were being seen. It was also found that there were a limited number of physicians seeking the certificate to treat these patients, and physicians generally offered appropriate treatment with great reserve. Due to the expansive number of deaths from prescribed opioid use, more than 30 states have now implemented the Prescription Drug Monitoring Program. This continually tracks the dispensing and prescribing of controlled substances by physicians. The program is believed to be partly due to the increase in heroin use that has been seen recently. Physicians are becoming more aware and cautious while prescribing opioid painkillers. The supply is diminishing, and the cost on the street for these pills are continuing to increase. Heroin is readily available on the street and is a cheap alternative to opioid use, and the demand and production of the substance increases, the cost decreases, which makes it even more of a magnet for its users. Synthetic cannabinoids have become a popular drug of choice among various age groups. K2 and Spice are some of the more commonly being heard of. These synthetic drugs were originally created for cancer patients in the 90s by a university. They were created to help treat the pain from cancer in the same fashion that marijuana does. But due to the uncontrollable side effects, the project was completely abandoned. Several years later, these synthetic drugs were being sold over the counter to mimic the effects of marijuana and amphetamines. Cannabinoids are a mixture of herbal and plant substances that are sprayed with a synthetic cannabinoid solution and are used to mimic the appearance of marijuana. Research has actually found that synthetic cannabinoids have 100 times more of an attraction to cannabinoid receptors in the brain than marijuana does. They also have a longer half-life, which leaves the users with potential adverse effects that are unstable to the body and unknown long-term side effects, which I have listed here. A lot of these side effects listed are not short-term. They're both short-term and long-term. This drug's popularity is mainly due to the ease of accessing the substance, minimal cost for the substance, and the lack of its identifiability in a drug screen. What's new about this drug now is that it is classified as a Schedule I drug in the Synthetic Drug Abuse Prevention Act of 2012, and it is no longer unidentifiable in all drug testing. Despite the attempts to decrease the usage of K2 through regulations, there was a steady rise of reported cases to poison control centers in relation to the effects being encountered among adolescents and young adult users, making this a public health issue. Many individuals in our area see and use K2 are teens, which is why I decided to present my findings to an Oakville High School health class that consisted of 15 to 17-year-old students. There were 26 students in attendance in the class, and they were given a pamphlet, which I have shown below. that offered them with a list of side effects of heroin and K2-like products. They were also given a scenario in 2 bridges, and which each bridge presented a different set of dangers, and they were given the option to choose which bridge they would cross and why. In addition to this, they were given several real-life situations in which these drugs had greatly affected their users, either to their death or had made them permanently handicapped. At the end of the presentation, the students were given a short quiz, which I have listed here on the right. This was to explore if the information was received appropriately. It was found that majority of the students were able to answer all of the questions appropriately. While no one during the presentation would offer too much input, these quizzes proved that the group was more knowledgeable to these drugs than they led on to be. For example, no one would admit to knowing someone who used either substance, but on the quiz there were 8 individuals who answered yes to knowing someone who used K-like 2 products, and 3 answered yes to knowing someone who used heroin. 2 individuals admitted to personally using K2 on the anonymous questionnaire. While these children had convinced me that they did not know or personally use these substances, it was shocking when the quizzes were reviewed. The information presented was received as proven by the responses to the questionnaires. 100% of these students were able to name 3 side effects of heroin, and 92% were able to give 3 side effects of K2. Surprisingly, there were 2 alternative names to heroin listed on the quiz that were not given in the speech. These students named the heroin candy. When asked for resources to get help, 84% of the students were able to correctly identify.